and the medial lateral glide are the handouts. Kleiger's is 421, external rotation is 422. Okay? I'm going to teach you my traditional Kleiger's test, although some textbooks do it slightly different. I'm going to teach you the way I want you to do it. All right? Traditional Kleiger's, and we'll do this ankle so video can see it. Traditional Kleiger's is testing for deltoid. Traditional Kleiger's is for deltoid. Very, very simple. It is a slightly plantar flex foot. We stabilize, and then we externally rotate the plantar flex foot. Okay, so I'm actually grabbing her foot and externally rotating. You can see me stretching that deltoid, correct? So it's not the tower tilt up here, it's an external rotation. I'm just kind of spinning her foot out. I'm not rotating like this, I'm actually just kind of rotating it out. That's Kleiger's, and we're looking for deltoid. The comparison of that is sometimes called modified Kleiger's, or the syndesmotic separation test, or the external rotation test. Disclaimer, a lot of special tests have names, okay? And that's okay. It's sometimes a person maybe tweaks it a little bit and they rename it so they can get published. Or a textbook needs to sell a new textbook so they change the name when it's exactly the same thing. So this is modified Kleiger's, external rotation, or syndesmotic separation. Well, if it's a syndesmotic separation, what joint are we looking at then? Tib-fib, correct? So I'm looking for the integrity of that distal tibia-fibular ligament. So what we do here is instead of plantar flex, we modify by putting them into dorsiflexion. And in dorsiflexion, what happens to the mortise in the talus? It gets compressed, correct? So if I do that and I do the same action, stabilize with external rotation, what is that talus going to try to do? Separate that syndesmotic. Agreed? So what is going to happen to that ligament if it's damaged? Ow, 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 stop, 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 right? So it's the same technique. I'm going to stabilize. I'm not rotating here. I'm actually externally rotating out here. And I'm trying to jam that talus into the mortise and see if I can separate it. Does that make sense? So their location of pain will be where? Right there. Normal Kleiger's, they should get deltoid. Now, some people, if you do this, may get a little syndesmotic pain with a standard Kleiger's because you are doing a little bit of that talus bumping. That kind of makes sense. So if I'm here, I am going to get a little bit. So they may give you a little pain here. So everyone okay with Kleiger's and now modified Kleiger's? And the same thing?
In the modified, are you passively having them?
I passively dorsiflex, and when I'm kind of jamming in there, I externally rotate them.
Okay. So they're still relaxed though?
Yeah. It's going to hurt them though. I mean, sometimes just even putting them into dorsiflexion may flare them up. Really? That's your flare up?
Yes.
You're awful. Okay, and now the medial and lateral, the talus. So what we're doing here is we're going back to the calcaneus and the talus, and instead of rotating them, I'm going to try to glide them. Okay? So you can do this either in this position or you can do it sideline. I'm going to show you both. So I'm going to start here in the supine position. I'm basically going to take her, I'm going to grab the calcaneus, and I'm just gliding it. See, I'm not rotating it, I'm just trying to glide it. Medial, and I'm gliding it lateral. There should not be a lot of motion there, correct? It should be all nice and tight. But especially with the lateral glide, which lateral, also called the cotton test, they're going to get pain in the syndesmotic. The same idea, I'm actually gliding the talus in the mortise, so it's going to be separating the tibia and the fibula. That sort of makes sense? The modified version of this is sideline, so she'll lie on her left side, the ankle will be off the table, okay? I can stabilize here, and I can actually, it's easier this way to do a medial glide like this, and then I can flip her over, and obviously stabilize, use the table, and there's your lateral glide. Not a lot of motion. There shouldn't be a lot of motion. This is more of a ow, 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 stop you jerk. Okay? So you're not really going to get that big empty end feel because otherwise that means that her tibia and fibula are doing this. And that's simply not going to happen. You're nice and talus falls off, okay? That makes sense so far? All right, so let's try that. I want